So good morning, everybody. Welcome to the impacts of COVID-19 on water security and environmental justice. It's a webinar of the Rosenberg International Forum on Water Policy. You probably know where you are. We're getting started here, and this shows how you can participate today. Just a quick reminder before I pass it off to Sarush. Please do feel free to ask your questions as they arise by typing them into chat. If you'd like to ask a question for live at 9:30, just raise your hand and we'll call upon you to unmute and ask that question. Otherwise, do type them into chat and we will answer, the speakers will answer those at 9:30 with moderator's assistance. So thank you, Sarush. I'll pass it off to you now.
Well, thank you very much, Sherry. Good morning, good afternoon, good evening to all the participants in our second webinar of 2021/22. Exciting topic, excellent speakers, which of course Andrea Berlich, who kindly organized this particular webinar, will introduce. I'm the chair of the Rosenberg Forum at the present time, and I wish to acknowledge Henry Vox, who was the founding chair, who's also participating and was a great mentor to me. My colleagues, Doug Parker and Sherry and the rest will introduce themselves. We don't want to take too much time with the introductory aspects, but definitely Glenda Humiston, who's the Vice President of the University of California for Ag and Natural Resources, would have been with us to greet you all. Unfortunately, her schedule is always overcommitted, and this morning she had to be in Monterey, California for a conference, and sends her best regards and greeting and thanks all the speakers. With that, then I would like to introduce our board members. The slide that Sherry put up already introduced them in their pictures, and those who are present will say a few words. I know Christina Babbitt said unfortunately she cannot make it because of another commitment she has this morning, but the rest hopefully will be here and will introduce themselves. So let's start. Lucia, are you on board yet?
Lucia isn't here yet.
Okay.
Maybe we can come back to her.
Yeah, exactly. Of course, I see Ariel. Ariel, please go ahead.
Yes, good morning, good evening, everyone, wherever you are. Welcome to our webinar and hope that you will enjoy. Seems to be a very interesting topic.
Thank you, Yuan.
Hi, good morning, good evening, whatever you are. My name is Yuan Duan from Huahai University in Nanjing, China. Welcome to the webinar. Thank you.
Thank you. Alberto, are you online?
Don't see Alberto yet either.
Okay, yeah, so they will join because they probably at the end of their work day, they're probably still working. But Andrea, of course, will introduce herself now, and then later on she will run the show.
Thank you, Sarush. I'm Andrea Gerlach, and I'm a faculty member at the University of Arizona, and I work in water governance. Really happy to be here. And
we should congratulate Andrea, who was appointed as the director of the Udall Center at the University of Arizona recently. And it will now go to Helen Ingram, who happened to be the chair, the director of the Udall Center some years back when I had the pleasure of getting to know her when I was at the University of Arizona. Helen?
I'm so glad to say hello to you this morning. It's great to see you, and it's great to see Henry, who is very much my mentor, and Andrea, who I think is my mentee. I spent years at the University of Arizona and then moved to the University of California at Irvine. And one of the pleasures of my professional career has been as a longtime board member of the Rosenberg Forum. I'm happy to be here and look forward to this exciting topic.
Thank you, Helen. Ben?
Yeah, good morning. Thank you. Ben Maddox. I am the Food, Ag, and Wine Executive for Bank of America here in Central part of California. I think I'm the newest board member with a little under a year of time on the board, but very excited to be here and looking forward to the topic. Thanks, Sarush.
You're welcome, Ben. And this morning we found out that actually there is a street in Fresno named after Ben. So we are even more honored to have you. That's great. Ayman?
I don't see Ayman done yet.
Okay, so they will join. And then, of course, our Doug Parker needs no introduction, but he will introduce himself.
Greetings, everyone. I'm Doug Parker. I'm the director of the California Institute for Water Resources at the University of California. And really happy to be here with the Rosenberg Forum, which is one of our programs within that institute.
Great. And I think Sherry has already introduced herself, but let's go through Sherry and Kelly as well, that are always the force behind making sure these webinars run smoothly, or even the meetings. Thank you so much.
Thank you. Hi, everybody. It's great to see you today, and welcome. And I'm the administrative officer for the Rosenberg Forum and the director of the program support unit. Kelly, do you want to say hi for a sec?
Sure. My name is Kelly McFarland. I'm underneath Sherry at the program support unit, and I'm here to help and excited to be here.
Fantastic. At this stage, I will share the podium with Andrea. Dr. Garlick will run the program and introduce the speakers. And thank you so much, Andrea.
Great, thanks so much. It's a real honor to be here today to help facilitate our discussion on the impacts of COVID-19 on water security and environmental justice. Our aim with this webinar is to explore the scope and the distribution of water-related financial burdens caused by the COVID-19 pandemic and the subsequent economic hardships. We know that the pandemic has impacted water district financing, consumer water affordability, and in some cases availability. And we know that these impacts are unevenly distributed across populations and regions. Today, we've convened a panel of nationally recognized experts with diverse experience and perspectives to offer some insights into the impacts on COVID-19 on water security in the US. We're going to hear from them momentarily, but just a word about our structure for today. There are two parts to our webinar. We're going to begin with 10-minute presentations from each of our four panelists. They'll introduce themselves, present a bit about their work, that of the organizations that they work with, and outline some of the ways that they see COVID-19 impacting water security in the US. Then we'll shift to a moderated panel discussion with our panelists to tease out some key themes, and especially to think about pathways and solutions going forward. We're then going to open it up to the audience. So the last 30 minutes of our webinar, I think that's 9:30 to 10 Pacific Standard Time, but the last 30 minutes, wherever you are, whatever time zone, we're going to open it up to the audience for some questions, and you can put your questions in the chat, and we'll kind of curate and call those questions and then ask them of the speakers, or you can, beginning at that 9:30 in the last 30 minutes, you can use the raise the hand function. So we're going to begin with Zoe, who's with the US Water Alliance. And Zoe, thanks for being here, and I'm happy to turn it over to you.
Thank you so much for having me. My name is Zoe Roller, and I'm a Water Equity Fellow at the US Water Alliance. I'm going to present today on the challenges of universal water access and affordability in the United States. Next slide, please. So a bit about my organization. The US Water Alliance is a national nonprofit that works to create a sustainable and equitable water future by building alignment and collaboration between many diverse stakeholders in the sector. We work with water and wastewater utilities, policymakers, researchers, community groups, the private sector, basically everyone concerned with water. And we do this work through convening leaders, producing research and publications, and working in different parts of the country to advance equitable practices at the city level. Next slide, please. So I got involved with water when I lived in Rio de Janeiro for a couple of years, where I was working on environmental issues in informal settlements. And we did this work through convening leaders, producing research and publications, and working in different parts of the country to advance equitable practices at the city level. Next slide, please. So I got involved with water when I lived in Rio de Janeiro for a couple of years, where I was working on environmental issues in informal settlements. And I was working and living in neighborhoods there that had been left out of government investment in water infrastructure. And because of that, there were water outages that would last for days or weeks at a time. And once in a place I was living for over a month. So through that, I saw the impacts of living without 24/7 running water and wastewater treatment on your daily life, and how it makes it incredibly hard to do all the basic things: cooking, cleaning, getting to work on time, taking care of your family, and the anxiety and stress and mental health impacts that are caused by not knowing whether water is going to come out of your tap when you turn it on. So I came back to the US thinking a lot about water access and injustice here. And I think for many Americans, when they imagine communities that are living without running water or without adequate sanitation, they might be picturing someplace more like Rio in another country. And they might imagine that here in the US, those issues were eradicated 100 years ago. But the truth is that there are millions of people in this country who are living without running water or whose water is unsafe to drink or too expensive to use today. Next slide, please. In order to shed some light on this crisis, which often flies under the radar, my organization worked with Dig Deep and Michigan State University to release this report a couple of years ago. We looked at census data on water access at the national level, and then I visited water access hotspots around the country, which you can see on the map where we conducted our research, to talk directly to people who are living without water right now. Next slide, please. Some of our other work, we've also released a national survey of water equity challenges that covers climate impacts, workforce development, and opportunities for water to advance water equity. And then we do place-based work with about 30 cities, collaborating with utilities and communities. And we've put out reports on the water equity landscape in 7 of those cities. So these are some of the materials that I'll be referring to in my talk. Next slide, please. So I'll talk a little more about what these water equity challenges look like. In the research that we did for that report, we found that there are more than 2 million people in the US who live without either running water, a tap, or a toilet inside the home. And there's many more people who may lack adequate sanitation, but we don't have thorough data on that. So as you can imagine, this really exacerbated the impacts of COVID if people didn't have water in the home to wash their hands and take proper precautions. So many of the hotspots that I showed on that map were heavily impacted by COVID. So what this looks like, when I visited West Virginia for the report, I went to a town called Keystone, and I heard from residents there that they often don't have running water for days at a time because the town doesn't have the funding to maintain their system. When I went to Alabama, I met with a family who told me that their children can't play outside because sewage overflows into their backyard regularly. These challenges are not affecting all people equally. Our research found that race is the most significant factor in whether you have access to running water and indoor plumbing. And we found that Native American households are 19 times more likely to live without complete plumbing than white households. And for Black and Latinx households, they're twice as likely. So this is a racial justice issue. It's also a poverty issue. Many of the people that we interviewed with water access challenges were living on $10,000, $20,000 a year for their whole household. So poverty is a major obstacle to water service. And while access may be improving overall for the country, there are places like Keystone where their services are actually deteriorating and people are losing access that they once had. Next slide, please. And in the places that do have infrastructure, a lot of our infrastructure in this country was built several decades ago or even a century ago, and it's starting to break down and need a lot of maintenance. In O'Toole, which is another town in West Virginia, residents there told me that their aging water system was becoming so contaminated that people would shower under rain gutters rather than risking their tap water. And at the same time that there's this massive need for investment in water systems, the federal funding that's available has been declining pretty dramatically. In 1977, federal funding made up about 60% of total spending on water projects. Today, it's only 10%. Next slide, please. What this means is that water systems are primarily dependent on customer rates for their revenue to do the maintenance and repairs that they need to do. So they need to raise their rates to cover those costs, but many of their low-income customers can't afford the rate increases. A study showed that about 3 million people a year experience a utility shutoff, and that's in a pre-COVID year. So things have been different since 2020. Having your water shut off can affect people's health. It can cause people to lose their homes. And people in this situation do technically have access. They have pipes coming into their home, but they're effectively living without access if they can't use it while they're shut off. I've heard stories about people who are shut off for months or even years because they can't afford the fee to get reconnected, and they get by doing things like hauling buckets of water from a neighbor's house. And there are cases where people's children are removed from the home because their water is shut off. This has become extremely urgent in the past year, with utility debt in the billions as people were hit by the financial impacts of the pandemic. Next slide, please. And then there are many communities in this country who do have running water in the home, but they're not able to drink it because it's unsafe. When I was doing the research in California, I met a family who said that their tap water was so contaminated that it burns their eyes when they shower. And their house, like in this photo, was filled with a lot of bottled water. There are 44 million people who are served by systems with Safe Drinking Water Act violations. And water quality contamination comes from a lot of different sources, but some of the big ones are lead and agricultural and industrial runoff into water sources. Next slide, please. So how did we get to this point, and what are some of the causes of these inequities in water systems? Many of the disparities in water access and affordability are due to our country's history of colonialism, segregation, and other injustices that have shaped who has access to wealth and opportunity. The US overall made a lot of progress on water access in the 20th century because there was significant federal funding for water systems between the 30s and the 1970s. And it was really successful. Between 1950 and 1970, the number of people without complete plumbing fell from 27 to 5%. So that's a lot of progress. However, there were some communities that were not included in that investment. In the early 20th century, the federal government subsidized the development of drinking water systems and irrigation for settlers in the West, but it came at the expense of tribes. And that continues to this day. Tribal water rights continue to be violated, with just one example is the case of the Dakota Access Pipeline. And as a lot of towns and cities developed their water systems, there were practices where communities of color were excluded. An example of that is a town called Zanesville in Ohio, where they did not construct water lines into African-American neighborhoods. In California, in the Central Valley, rural Latinx communities were discouraged from incorporating, so they didn't have access to the same funding to build infrastructure that neighboring towns did. Some of these discriminatory practices have ceased and are no longer happening, but they still shape conditions today. In the 1980s, the funding landscape shifted and the federal government moved from offering a lot of grants to mostly offering loans. So rural areas, tribal communities, low-income areas may have a harder time accessing capital or taking on those loans. And this means that the communities that were historically excluded from infrastructure development have an even harder time catching up to the rest of the country now because of how funding has changed. So where do we go from here? These are very daunting challenges, but the good news is that the US is a prosperous country with significant resources and expertise, and there are communities all around the country innovating and developing strategies in response to these challenges. So I believe that it's completely possible to close this gap in our lifetimes. I know we're going to talk more about specific policy recommendations in the Q&A, but just a few things that I wanted to close out with that are key to closing the water access gap and ensuring universal access. Next slide, please. Communities that face these water challenges are living in a state of emergency right now, even without the added emergency of COVID. They're drinking water that may be unsafe, they're risking exposure to sewage. And this has been seen as a more urgent issue due to the connection with COVID, but it was urgent before 2020. So we need to be treating this as a crisis and developing immediate innovative responses, as well as thinking long-term. and putting in permanent solutions. Next slide, please. So I know there's always a need for funding, and we'll talk more about this, but we should also be thinking about how we fund water and reimagining the utility business model. Next slide, please. Water is interconnected to all aspects of communities, and investing in water can be an opportunity to address other challenges. So organizations that are focused on water access can think about partnering with other sectors like food security, public health, climate resilience, affordable housing, and creating multiple benefits. Next slide, please. And lastly, these strategies that we develop are only successful if they work for communities themselves and if they're led and developed by communities. So we should be thinking about community involvement in water governance and decision-making in implementing strategies in response to water access issues. Thank you.
Thanks so much, Zoe. It's great to hear about the work of your work and the work of the U.S. Water Alliance. Those are great images, and it's great to see what you're learning about communities across the U.S. Thank you so much. We want to turn it over to Joaquin now. He's with the California State Water Resources Control Board. You're up next.
Thank you so much, Andrea. And thank you, Zoe, for the great introduction on a topic that California has been working on a bit. And I think we ultimately, as Zoe said, have a real opportunity here to really change the way we think about water in the state and really put forward first the communities that currently don't have access. And especially when I think we also take for granted that we do and or otherwise imagine that most of our communities do have access to clean and safe water. So again, yeah, my name is Joaquin Escobar, and I'm chair of the State Water Resources Control Board here in California. We're a 5-member board. We each have different specializations. There's a water attorney, there's sanitation engineers, and I hold the public seat and take very, very seriously then, the spirit and purpose of a public seat. And here for me, it is really connecting and ensuring that the public best understands the board's work. Here, I will begin sharing my screen here. And what I'll do is go through just a general background of the State Water Resources Control Board, our purview and work, dive into our safe and affordable fund work, our safer work, which you'll see is very much one of our primary programs when it comes to really bridging this access and equity gap when it comes to water, both in drinking and sanitation access. And then give a few thoughts on a program that we just developed to respond to the COVID crisis and the arrearages that we were seeing in households because of the economic downturn and moratoriums that were put in place to protect public health. So here, the State Water Resources Control Board is amongst the boards, departments, and organizations under the California Environmental Protection Agency. It includes our brothers and sisters over at CARB, the Air Resources Board, Cal Recycle, Public Health. That we have the Office of Environmental Health Hazard Assessment, importantly as well. There are partners when it comes to developing maximum contaminant limits in drinking water and toxicology issues. And DTSC as well, who help us on cleanup funds and important partners in the Cali PA family. So quickly, we are one State Water Resources Control Board and then 9 regional water quality control boards. Those regional boards you'll see in a moment are actually watershed based. The state of California, as large and varied as we are, have to have regional water quality control boards that implement our water quality programs. And because of the great variety of issues, contaminants, and hydrology that the state finds. We're about 2,300 employees statewide. That includes those regional water quality control boards, and those all employees. And here for a second, I'll actually go over to our divisions. The breakdown here is we have our Division of Water Rights, where the state board. So the state board sets water quality standards and frameworks here at the state level, obviously, and the regional water quality control boards implement those. Each of those regional water quality control boards have their own chair, they're 7-member boards themselves. They have an executive director, they're quasi-independent. And so in the water quality side, that's how the framework breaks down. The state board then also oversees water rights. And so we have the Division of Water Rights, About 5 or 6 years ago, the Division of Drinking Water came over from the Department of Public Health, and so was recently added to the board's purview, which it was established about here, and I'm sorry to jump back around on my slides, which was established back about 50 years ago with the Porter Cologne Water Quality Control Act, which actually predated the Clean Water Act and actual sections of and the identification of beneficial uses, the various basin planning activities that go on were actually incorporated and put into the Clean Water Act. So California has a strong history when it comes to leading in the space of water quality regulation. And in the 50s, the Porter Cologne Water Quality Act actually united a water rights office that was established in 1914 and these local pollution control boards which were established in the 40s with the spirit that you have to regulate water quality and quantity in the same breath. And then most recently, again, with the Division of Drinking Water being brought over, the Safe Drinking Water Act is part of our legal framework here. And most recently as well, the Sustainable Groundwater Management Act has a regulatory role for the Water Board. And here then is the framework that we use in our laws and regulations when it comes to then the many miles and acre feet of lakes, bays, estuaries, streams, and rivers here in the state of California, which we are called to protect. Here again were our divisions. I'll just touch on our Division of Financial Assistance, which actually here is at the state board and is our largest by staff of all of our divisions, and is actually really critical when it comes to trying to accomplish our mission of attaining water quality standards and protecting the beneficial uses of them throughout the state, and also regulating drinking water systems and wastewater systems who require incredible investment, as Zoe said here, and because of the, although we do receive loans to the SRF, but because of the more historic retreat of what were more significant federal funds, a lot more pressure has come on the state to provide for drinking water systems, and here to really bring our arms around the great challenge that we have. Quickly, here are the 9 regional water quality control boards, and you can see them broken down by really hydrologic region, with of course our Central Valley region being one of the largest. So generally what we do again is protect water quality standards and set water quality protection plans at the state level. We allocate water rights, we adjudicate those water rights, we regulate drinking water, and we set drinking water standards. So here is part of our issue. Here are the drinking water systems throughout the state of California. I say part of our issue because we have over 7,000 water systems in the state of California. It's an incredible amount. On the right, you see a map here of actually our systems that have failed. They're not meeting maximum contaminant limits, and then a breakdown of, I'm sorry, I believe I'm hearing a little feedback. And then a breakdown of kind of where they are in receiving financial assistance from the board. And this is actually, I'll just caution the map on the right, I think is a little stale, but at the same time, I think captures the at least failing systems that we see. And again, there are over 7,000 in the state. About 15 of those are owned by an investor-owned utility. They're a private water system. The rest, 85%, are public systems. Of the ones that, of that 7,000, about 3,000 or so are under the board's purview and are above 15 connections. Those below are under the county's purview. And that split also creates challenges. You have counties that have the resources and ability to oversee systems, and sometimes not. Again, we have about 300 systems that are not currently meeting maximum contaminant limits and are about represent about 1 million Californians here in the state. I think it's important to remember that about 400 systems in the state of California serve about 95% of the population. That rest of the population, again, that's still 3,000 systems that we oversee, are many smaller systems, even in urban settings that have challenges. And we see that because over 90% of our violations come from systems below 500 connections. So, we see a direct relationship between size and ability to maintain service. And that's why, as Zoe pointed out, when you have communities that are purposely, not extended service, not included into a more regional water supply and system, you get the many challenges that we see. And those challenges include water quantity challenges. California has incredible variability when it comes to its precipitation. That small map, and I apologize for the denseness of all of this. Hopefully the slides will be provided and folks can read through it. But the small map at the right shows year-to-year variability in precipitation, and you can see how we just light up, quite literally. California has incredible variation. And so you see here then that shift between wet and dry years. Dry years, we find ourselves incredibly dependent on groundwater, particularly in places like the Central Valley. That has huge impacts on drinking water wells, which are often more shallow and don't have the resources that other interests, ag, that have the dollars and the ability to drill deeper. And this balance is something that we really saw as an issue in the last drought, and is part of the impetus of the Sustainable Groundwater Management Act that I mentioned earlier, which in part is here a drinking water challenge. Here quickly as well are then the water quality stressors that really impact the ability to serve and provide clean drinking water. They vary by region. You have a lot of legacy contamination and issues. And again, this is a small slide, so I apologize for some readability. But hopefully it gives you a good sense of the scale of the water quality stressors that are out there, and it drives affordability in a huge way. It is the primary driver of affordability for our systems is the cost of treatment for water. And we know here that with emerging contaminants of concern that we're having to address, including PFAS, harmful algal blooms, which climate change will continue to be an even bigger issue, and even microplastics. These will all come at additional costs, and the focus must continue to be how to support these systems and not sacrifice improvements in water quality, but really let the science guide us, and ultimately as well, though, make sure we have the systems of support to ensure that communities can meet these standards. So here in the state of California, we have what's known as a human right to water, and it's been a progress and a succession of events that have kind of brought us to an opportunity, I feel, here within the state to really try to live up to the potential of a human right to water. So in 1921, actually, the domestic use for water was elevated, if you will, in the water code to the highest and best use. So meaning that there is a priority on people and communities and their drinking water. But it was in 2012 that we actually adopted a human right to water here in the state of California. It came with some caveats, mainly the ones that said, here is a human right to clean, that here in the state of California, our water code says that there's a human right to clean, affordable, accessible water for the purposes of cooking, drinking, personal use, sanitation, but didn't come with additional dollars. It didn't come with any additional authorities, no new real way to accomplish it. It was left to the agencies to try to interpret and understand how best they can do that. The state board then did so after the Division of Drinking Water was transferred from the Department of Public Health in 2015 or so, with a resolution in 2016 outlining how the board would advance the human right to water. And through the leadership of Governor Newsom in 2019, there was passage in the state legislature here of our Safe and Affordable Drinking Water Fund. It provides here $1 billion over about 10 years, a decade, from the Greenhouse Gas Reduction Fund to provide for operation and maintenance, which we don't have. We have capital dollars, we have had technical assistance dollars and have a lot more now, but and importantly, operation and maintenance was something that many of our systems we could see we may very well need. And without a flexible pot of funds to really begin to better deliver services to smaller systems. It was really it wasn't easy to really get at these challenges. And so now what we have is 2 years of progress with our SAFER program. And it emphasizes importantly, first the fund, the dollars, but data collection and analysis. We're focused on consolidation and regional solutions. We have administrators, and importantly, are increasing our technical capacity for communities, which is really part of the problem. I was in DC when the American Recovery Act was passed, and the emphasis on shovel-ready projects really undermines the ability to deliver projects for smaller systems and communities who don't have shovel-ready projects. They don't have actually the phalanx of lawyers and contractors and engineers to have a project at a shovel-ready state and ready to accept dollars. And it's why technical assistance is such a critical component actually of the work that we're doing. And I'll just note, administrators are a tool that we have to be able to appoint administrators for failing systems in an attempt to try to, again, really bridge the resource issues of many of these systems. We've completed a drinking water needs assessment, which importantly has looked at all the systems under 3,300 connections, domestic wells and state smalls, to understand what is really the scale and scope of the challenge that we have. And we identified a funding gap of about $5 billion over the next 5 years or so, which now with the federal dollars coming down and other resources are going to become well timed. Here again about the program and our focus on interim solutions, comprehensive assistance, and trying to accelerate project timelines. I was just recently at a ceremony for the community of Arvin in the Central Valley, where they were just having their arsenic order lifted from US EPA after 12 years of trying to attempt to address issues in that community. And those timelines definitely need to be shortened. Here then is the funds we had available just this last year for the Safe and Affordable program, which includes the SAFER fund, but then also general fund appropriations and other dollars from the Drinking Water State Revolving Fund, the loan forgiveness and other funds. Here now is what we have this coming year. We had an incredible infusion from the state budget because of surpluses to have even more resources here to continue to address, of course, those systems that are out of compliance, but really start to get at those at-risk systems that are needs assessment addressed and start to get ahead of the issue. And here's just our funding priorities for all those dollars. Quickly then now, and because I apologize if I've not kept track of my time, I don't know if I've gone over a little here, but is our arrearage and relief program. Incredibly, here at the start of the pandemic, it was recognized very quickly that access to sanitation, especially as we had stay-at-home orders and we're asking folks to shelter in place, was incredibly important to stop the spread of disease and the COVID-19 response. It was the #1 public health message was to wash your hands, and that access to sanitation was so critical that we placed a historic moratorium on all water shutoffs within the state, and that is lasting here until the end of this year, I believe, actually. But we are already now sending checks out for this arrearage program. We were given the dollars and had to quickly scramble to pull together a program here in this last summer. Thankfully, we had some work that we had conducted the previous fall, where we had had a phone survey of all the systems in this, well, I apologize, not all the systems, a statistically significant number of those systems. And we actually, figured out how many we had to hit and where to be able to try to best assess how much debt had been accruing, because it was a grave concern of ours, hearing some anecdotal information that because of the economic downturn and the moratoriums and then inability to pay, but some systems were seeing revenue impacts of 50, 60%, and really concerned about dipping into and not having revenues and having to forego important things like maintenance and other things that can start to get a system into problems. So we did that survey, found about $1 billion in debt. Some agencies have multiple utilities on the bill. It's not just water. It's sometimes sewer, it's trash, or also energy in the case of LA DWP and other multiple utility agencies. And so, that number was a helpful guide to understand the need, and the state legislature and the governor responded. And that leadership then led to $1 billion program here to forgive debt accrued during the moratorium here. There was a cutoff of this last June to be able to or July to be able to actually kind of calculate the numbers and start to get the dollars out. And so those funds are flowing now. December 6th is the deadline for the program. And importantly, it ensures that systems can't shut off those that are, if you're participating in the program. We're looking to prevent any mass shutoffs here as a result of the COVID downturn, and are just incredibly fortunate for having had this opportunity to enact very quickly here an arrearage plan that we're able to learn quite a bit about actually. And here's just more information on just the program's details. But I think importantly, low income rate assistance program is something that is very needed. It's not even likely needed. You look at other important services like your cell phone or electricity or food, and likewise we have support programs to ensure that there is equitable access amongst our communities to something so critical to life and to all of us. With that, I think I can stop and look forward to further discussion and delving into some additional detail around the response and impacts from COVID on all of these issues of access and affordability, and just thank everyone for this time.
Thanks, Joaquin, so much for giving us such a complete picture of how things are looking in California. Really grateful. Now we're going to go to the other side of the country, to Philadelphia. So welcome, Glenn, with Philadelphia Water. Let's hear about what's happening in Philadelphia.
Hi, everyone. I'm Glenn Abrams. I'm Deputy Commissioner of Communications and Engagement at the Philadelphia Water Department. So let me just start to give you a little bit about Philadelphia. Philadelphia is located in southeastern Pennsylvania, within the Mid-Atlantic region of the United States. And with a population of just over 1.6 million people, Philadelphia is the 6th largest city in the US. And we were recognized as a World Heritage City in 2015. We have Independence Hall, which is recognized as a UNESCO World Heritage Site of outstanding universal value, but we have a very rich array of historic buildings and cultural areas. Philadelphia has a very diverse population, and with expanding immigrant communities in recent years. And of note, nearly a quarter of the population speaks a language other than English at home. And also of note, with a poverty rate of 24.3%, Philadelphia is the poorest of the top 10 largest cities in the United States. The Philadelphia Water Department, or PWD, I'll refer to it that way throughout the presentation, provides the city with integrated drinking water, wastewater, and stormwater services. We operate 3 water treatment plants, treating over 300 million gallons of water per day. In addition, we operate 3 water pollution control plants and maintain 19 pumping stations and over 3,700 miles of sewers. And we manage a very robust stormwater program, which I'll talk a little bit more about later. From a governance standpoint, we are one of the city's 10 operating departments. We serve under a dedicated water fund established pursuant to the city charter, and we are fully funded by our customers, not by taxes. As with any water utility, PWD must consider and address numerous regulatory requirements to achieve long-term health of our environment. We are in the midst of large multi-year capital programs and growing expenses associated with aging infrastructure coupled with regulatory compliance. So these are creating stress on water rates and affordability. Philadelphia's Green City Clean Water Program utilizes an innovative combination of investments in green and stormwater infrastructure, coupled with targeted improvements to our robust sewer system to address our obligations under the Clean Water Act to reduce combined sewer overflows. The primary metric for the program, the green to acre, represents management of 1 inch of rainfall from an impervious acre of land. The program follows a presumptive approach to pollutant reduction, linking reduction in volume of overflow to removal of pollutants. The capital expenditure for this 25-year program is projected to cost approximately $3.5 billion. PWD's Drinking Water Master Plan established service level goals for 6 categories to guide the planning process, and these are water quality, water quantity, operability, service pressure, capital availability, public perception. 400 individual projects were identified at an estimated cost of $2.5 billion over 25 years. These projects will update and expand the existing infrastructure and improve redundancy. A recent analysis of our sewer system suggests that a significant portion of that system will reach the end of useful life by 2050. In anticipation, PWD is expanding its sewer assessment program to identify, renew, and replace sewers in a more proactive manner. And to combat the consequences of aging buried infrastructure, we have doubled the amount of water main and sewer targeted for replacement for renewal each year. Of course, again, with Philadelphia's poverty rate, we do have an issue of water affordability. So the 2 maps illustrate the past correlation between poverty, shown on the bottom, with the highest poverty shown in the darkest colors, and water shutoffs for non-payment, shown on the top map, with reds and yellow showing the greatest incidence of shutoff. PWD aimed to find a way to make monthly bills more affordable and protect our customers from shutoffs and encourage timely payments. And this is to fulfill our mission to provide all Philadelphians with safe, reliable, and affordable water. Over the years, we have developed a suite of customer assistance program, and the tiered assistance program flexibly addresses some of the most critical affordability issues that Philadelphians face. Launched in 2017, the Tiered Assistance Program, or TAP, is a nationally recognized affordability program for low-income customers and customers with special hardships. Monthly bills are based on income, which can range from 2 to 4% of a customer's total household income. Lowest income brackets may have a minimum bill of $12 per month. Customers do not need to be delinquent or behind on their bills to enter the program, so this allows us to be proactive with assistance as opposed to reactive. And the bills do not go up based on usage. Customers pay a set amount, which makes for budgeting, it makes it much easier to budget. Customers who may have a higher income but have experienced a hardship such as a loss of a job, death of a primary wage earner, or serious illness may still be eligible for the program under the special hardship clause. Past due amounts are suspended and not enforced upon while successfully enrolled in the program, and so that prevents debt from increasing. And earned forgiveness of prior penalties and past debt can be achieved after 24 months of on-time payment. So that is a huge that people have a pathway to eliminate water debt. Currently, there are approximately 17,000 accounts enrolled in TAP. Of course, with COVID-19, people's lives were turned upside down. Many people lost their jobs or were furloughed, and many people got sick and were faced with medical bills. At that time, the Water Department restored service to over 15,000 customers at the start of the COVID pandemic that had their water shut off. The city imposed a moratorium on shutoff for delinquent accounts, and currently the moratorium has been extended for residential customers until at least April 1st, 2022. The Water Revenue Bureau waived penalties and fees on delinquent accounts until May 1st, 2021. And with so many customers' circumstances changed due to COVID-19, we proactively reached out to those already enrolled in TAPS and other assistance programs to see if their bills could be lowered further. We also increased our promotion of our customer assistance programs, including TAP, through social media and radio advertising. And these efforts are continuing today with an emphasis on reaching Black customers and Spanish-speaking customers. In early 2020, Philadelphia Mayor Jim Kenney signed an executive order mandating that the city government focus on true equity as a core imperative. By 2023, all city departments will complete a racial equity action plan, identifying strategies to produce greater racially equitable impact relevant to each agency's mission. This work is led by the city's Office of Diversity, Equity, and Inclusion and focus on 4 broad priorities: building a workforce at all levels that reflects the diversity of the city we serve, advancing a shared framework to embed racial equity as a governing principle in the city's budgeting, community engagement, service delivery, and significant strategic initiatives, promoting equitable procurement, contracting, and entrepreneurship outcomes, and working collaboratively with city departments, community partners, and other institutions to understand institutional racism, eliminate racial inequality, and improve outcomes for all, while paying closer attention to communities who are worse off. So a little bit about how the water department is beginning to integrate this idea of equity into its work. So let me go back to the Green City Clean Waters Plan. The cornerstone of Green City Clean Waters Plan is the widespread implementation of green stormwater infrastructure. We define green stormwater infrastructure as a range of soil, water, plant systems that intercept stormwater, infiltrate water into the ground, evaporate and transpire water, harvest and reuse it, and in some cases slowly release a portion of it back into the sewer system. But really, the heart of green stormwater infrastructure is that it replicates a more natural hydrology in an urban environment. One of the significant one of the significant benefits, of course, of green stormwater infrastructure is that the opportunity to leverage PWD's required investment in stormwater management to help improve neighborhoods throughout the city, particularly those that have been historically underserved. And compared to traditional underground infrastructure, there are many co-benefits of green infrastructure that can benefit communities, such as providing new green space and open space, preserving and restoring habitat, advancing neighborhood livability and public health, providing resilience to extreme weather and climate change, creating a local green economy, supporting urban revitalization, increasing market values and attractiveness. At Philadelphia Water, we believe in the importance of intentionally and honestly engaging with the community. We have a team of outreach and communication specialists that have developed a comprehensive education and community engagement workflow. Over the years, we have worked with a variety of professionals to communicate messages through different vehicles to reach as many people as possible. We work with environmental educators, the media, artists, muralists, dancers, singers, and even more recently, a poet to help us communicate. This work is about reaching communities, listening intently, being open and transparent, and ultimately building trust. I'll conclude with a recent example of our education and community engagement work. For many years, the Germantown community in Philadelphia, which is predominantly Black and low and moderate income, has experienced frequent flooding due to sewer capacity issues. With more frequent, intense rainfall events, the situation is worsening. Working toward a long-term solution is complicated, but is advancing. We have formed a community flood risk task force and are working with community leaders on developing a unique public engagement process. And with grant funding through the U.S. Water Alliance, we were able to work with Philadelphia's Poet Laureate to lead a series of poetry workshops as a means of engagement. We found this exercise to be very effective at getting people to open up about their true feelings and frustrations related to this issue, and it is a good foundation for our future engagement work. And this work provides an opening for us to share important information. In the end, fostering two-way communications like this can lead to strong relationship building and trust building. Thank you very much.
Thanks so much, Glenn. Really appreciative. Thank you for sharing some of the challenges and some of the work, the efforts that you're taking at Philadelphia Water to kind of meet those challenges. Thanks so much. I see that people are starting to put some questions in the chat. So if anything kind of comes to mind as you're listening, please do that to kind of capture your question, and we'll come back to it when we get to Q&A. I'm happy to turn it over to our final speaker, last but not least, Carletta Chief. She's a colleague of mine here at University of Arizona. Thanks for joining us, Carletta.
Good morning. Thank you to the Rosenberg International Forum on Water Policy, the chair, Dr. Suri Sarushan, and Dr. Andrea Gerlach for inviting me to participate in this session. I'm speaking from the University of Arizona, which is located on the traditional homelands of the Tahana Atam and Pasca Yaqui peoples. And this is Native American Heritage Month that we just celebrated in November. Please first allow me to introduce myself in my Diné language. I am bitter water born from my father, who is near the water. I'm from the Navajo Nation. I was born and raised there without running water and without electricity, and really grateful to have been taught my language and my culture. The COVID-19 pandemic generated fear and uncertainty as the infection and fatality spread across the globe. COVID-19 disproportionately impacted Indigenous communities who already experienced poor access to healthcare, higher rates of diseases, lack of access to essential services. And the United Nations Special Rapporteur on the rights of Indigenous peoples called for input on COVID-19 impacts on the rights of Indigenous people. And then in May 2020, the Center for World Indigenous Studies released a COVID-19 risk assessment in Indian country report, and they estimated that there are 319,000 community members that have chronic health conditions in tribal communities. They found that pretty much most of all Indian country is at high risk. 11% suffer from chronic disease, and there's no data gathering that was reliable and systematically collected in Indian country. COVID-19 on tribal lands are 4 times the average in the United States. And Dr. Betsy Rodriguez Lone Bear, she's a Crow UCLA professor. She released one of the first papers in August 2020, and she did a regression analysis of tribal data in the first pandemic wave, and that analysis revealed that COVID-19 rates were higher on reservations, with larger shares of homes lacking complete indoor plumbing, and was lower on reservations where there was a high percentage of English-speaking households. In the United States, COVID-19 was rampant on the Navajo Nation, which is the largest tribe in the United States, where poverty rates are twice the state of Arizona. And Navajo leaders cited lack of access to healthy foods and running water, such as Zoe was talking about, as reasons for this prolific transmission, which resulted in one of the highest rates in the United States, third only to New York and New Jersey. Native Americans also have the highest rate of diabetes, and comorbidities such as diabetes and cancers are prevalent on the Navajo Nation. Similarly to what Zoe talked about, environmental injustice, historical trauma, colonial impacts of historic environmental injustices. This is true on the Navajo Nation, where there are over 500 abandoned uranium mines. Navajos are at risk to environmental exposure to these mines, and the arsenic that's prevalent in unregulated water sources are often used for drinking water. And recent research has shown that arsenic and water is related to diabetes. So food, energy, and water insecurities were amplified on the Navajo Nation during the pandemic. The Navajo Nation is a food desert with only 13 grocery stores across the 25,000 square miles. Furthermore, there 30% lack running water, 40% lack electricity, and the people have to drive 50 to 50 miles away, incurring an enormous expense of $13.30 per 100 gallons in comparison to 40 cents per 100 gallons in a nearby city. So developing technical solutions to these challenges requires that we understand Indigenous societies, their governance and culture, and the ability to respectfully work in these contexts. So our vision at the University of Arizona is to develop a diverse workforce with that intercultural awareness, with expertise across the food, energy, water nexus. And so we've been working within that college to do this through the Indigenous Food, Energy, Water Security, and Sovereignty program to educate and train our students while mentoring and working with tribal college students. So in Indigenous Views, our research theme is centered around the development of off-grid systems. I saw some questions in the chat about decentralized systems, and that's what our focus is that many of the Navajo people live too remotely to get centralized water. And so we're looking at ways to do off-grid, develop off-grid systems. Here's a picture of one system that we developed in partnership within that college. And so this is the off-grid solar nanofiltration system, which treats non-potable water to produce drinking water. The unit sits on a trailer bed and is powered by solar panels and produces water for several families. So our partnership with the Navajo Nation to address the linkages between COVID-19 and water insecurities began with the invitation by Ricky Nance, who's the chair of the Navajo Tribal Council Resources Committee, and about our off-grid systems and as a possible way to address the water insecurities during the pandemic. They had also received care funds to develop a new transitional watering point. So we were invited to the Navajo Nation Water Access Coordination Group, which is an entity with many different state, federal, university, nonprofit organizations, including Dig Deep that Zoe mentioned, to address water security during the pandemic. So this is a map of what the Navajo Nation Water Access Coordination Group was doing to create new transitional watering points. So as part of our work within the Navajo Nation WAGI, we wanted to pilot these household water systems in homes. So we work with Six Source Solutions to co-design household water systems, basically downsizing the unit that I showed you earlier, but then working with Six Source Solutions to identify new designs. And we also did community engagement with the community in a safe way to talk about our systems and what we are doing. And one of the things is that in piloting these off-grid units, we also wanted to understand what the people thought about these systems, asking about what challenges they faced during COVID-19 in terms of their food, energy, water insecurities, and what if these technologies would be something they would consider. So our partnerships included several universities that have been working with the Navajo Nation for decades, and our aim was to look at various factors, including socioeconomic factors, built environment, natural environment, household, drinking water access, transportation, and food access, to look at community resilience and adaptive capacity and how that links to COVID-19. So this map shows the Navajo Nation and homes lacking plumbing by chapter units, which are analogous to states. So you see that the highest number of homes lacking plumbing, greater than 45%, are primarily in the western and southern regions of the Navajo Nation, with some bordering the Hopi Reservation. We also looked at food access, and the Navajo Nation is the size of the state of West Virginia. So they're rural and remote, and we looked at the distance to grocery stores. There's 13 grocery stores on the Navajo Nation, 50 off the Navajo Nation. So you can see the light green regions show families who drive 20 to 40 miles to get food. We also look at distance to regulate watering points, and the light blue areas show families that drive 10 to 20 miles. Many people who don't have pipe water haul water. Many haul water from non-regulated water sources, which can be springs or livestock wells. This map shows the levels of arsenic on the left and uranium on the right, and both are contaminants of concern. And if you remember the previous map, you can remember that those who had no pipe water are also located in the regions with elevated levels of arsenic and uranium. So in collaboration with Joe Hoover at Montana State, we conducted preliminary analysis using publicly available data on household characteristics from the ACS and COVID-19 cases from the Navajo Epicenter dashboard for 8 Indian Health Service area units. We didn't find a correlation between COVID-19 cumulative incidents and average percent of households without plumbing, but we feel that we need to look at the data at a higher resolution to understand this better. However, like Dr. Rodriguez-Lomber's paper, we also found that speaking only English households were negatively correlated to COVID-19 infection. And you can see that Kayenta had lower English-only speakers and higher rates of COVID-19 infection. And this preliminary results are important to understand that the developing effective COVID-19 messages is important to preventing COVID-19 infection. And many people on the Navajo Nation, like the previous speaker was talking about, speak other languages other than English. And so public health messaging is really important. So in conclusion, community resilience is critical for the Diné communities to respond to and to recover from perturbations like COVID-19. Yet outside health metrics, food, energy, water resilience frameworks often fail to consider Indigenous perspectives. So engaging Indigenous perspectives may improve, for example, what we're talking about today, which is sustainable water resources, water security, resilience. And so our work with off-grid water technologies is the one potential solution for decentralized water security that may contribute to adaptive capacity, increased resilience in these communities. I want to thank our many sources of funding. I also want to acknowledge all my team members and universities who partner in this work. Again, gracias, arigato gomishita, to my fellow colleagues and the citizens around the world who are zooming in to watch this panel. Again.
Many thanks, Carlotta. Thanks for giving us a look at what this looks like on Indian land, especially here in Arizona, Navajo Reservation. Thanks so much. And it's always inspiring to hear about your work. Well, we want to shift to the second part of our webinar today, which is really our roundtable discussion, where we want to try to identify some themes, some synergies across the 4 different presentations here. And I want to start by asking the panelists, maybe just opening up if the panelists have any comments or questions they have for one another. Now that they've heard everyone's presentations, is there anything that you would want to comment on or dig into a little bit deeper?
I can start out the conversation. This is Carlotta Chief, and I had a question for Glenn Abrams. I was really interested about languages, and often, you know, when there is a disaster or, you know, like this pandemic, language is sometimes overlooked, and how effective it can be in prevention, mitigation. So I was wanting to understand a little bit more about the aspect of language in the Philadelphian communities that you spoke about.
Sure, be happy to address that. So other than English, Spanish would be the language that is most spoken, although we have large populations that speak Mandarin, Cantonese, and growing populations that speak other languages as well. Most of our communication is right now just in English and Spanish, but we are working to translate into more languages. But admittedly, we're really behind the ball on where we should be on that. But beginning to work with the Office of Immigrant Affairs to identify where we should prioritize and get that moving.
Thanks so much.
I have a question for Carletta. So here in the state of California, we're trying to get state dollars to federally recognized tribes. And sometimes some of our issue is, we require like limited waiver of tribal sovereign immunity around things like audits, and sometimes can't, have barriers, I think, when it comes to, it seems, to getting state dollars to federal tribes. Have you seen any of that challenge in Arizona? Do you guys find similar challenges there? And then kind of a related but separately, we also have a lot of tribes that were either disenrolled or are not federally recognized, but are still an important part of the need and the conversation here in the state when it comes to water resources. But find sometimes there's a tension or divide in amongst that, that there is the federally recognized tribes and those that aren't. Do you find some of those tensions as well? And just wondering what those, because I find sometimes those can be barriers or impacts to some of the discussion that we have with our tribes.
Yes. So one of the biggest problems, like Billy mentioned, is a lot of the historical trauma and colonial history of the United States, where a lot of these policies are based on the colonization of Native American communities, where they may or may have not warred against the United States in that earlier time, and those wars leading to treaties and being federally recognized. A lot of indigenous communities in California did not war against the United States, therefore they were not officially recognized. In addition, in terms of like blood quantum, those are all, we're being defined by the United States to be indigenous, whereas we have our own indigenous identity based on our clans, and we don't go by blood quantum when we talk about our identity, but yet the United States defines it that way. So those are all colonial systems of injustice that have really impacted people today. And furthermore, with the bureaucracies of federal funds, that have really been a challenge for many Native American communities to act quickly and go through administering those funds. But those are one of the things that I saw in working the Navajo Nation Water Access Coordination Group, with the CARES Fund having to be expended by December 2020. It's very difficult to mobilize that quickly in less than a year of the funds actually being obtained. So I think how the Navajo Nation worked about it was through this Water Access Coordination Group to collaborate with many different entities to rapidly think, brainstorm on how to expend the monies and get water to the people. So that'll be a really, really short answer to a very, very deep question. Thank you.
Great, thanks. I'd like to bring us back to challenges for a minute. Each of the panelists have spoken about challenges, a really diverse set of challenges facing water access, availability, and affordability. I wonder, are there specific challenges of simultaneously creating greater access to good, clean water and affordability? Who wants to jump in?
Well, I'll start. I mean, the simple answer to that is yes, it is a challenge. I know, like from our perspective, it's ramping up a lead line replacement program, for instance, takes resources. Addressing emerging contaminants takes resources, and all of those things put pressure on rates. And while we have the tiered assistance program in place, it is paid for essentially by a rider on the rest of the customer base. But over time, that puts some additional pressure on the customer base as well. So it really comes down to resources, and particularly in an old city like Philadelphia with aging infrastructure, we see the challenges ahead, and without state and federal assistance, it's going to be very difficult. It puts that full burden on the city itself, and many of whom really can't afford it.
Yeah, I can speak to that a bit. I think particularly in rural areas that are served by small systems, in places where most of the population is fairly low income, it's particularly difficult because our funding structures are really premised on having the bulk of water investment coming from the local level and coming from rates. So I visited a lot of places in conducting the water access research where the customer base really can't support any kind of rate increase. And that means that the systems aren't able to do maintenance or make improvements, and their services deteriorate. And for places where there is no system currently and one needs to be built, it's even harder. And there are funding mechanisms for more of the upfront costs, like construction of a water treatment plant, but there's less funding available for operations and maintenance. So there are situations where a town can get the funding to build infrastructure, but then they're not able to maintain it, and people don't end up benefiting from the services.
Yeah, and I'll say we have, I know real examples throughout the state where that's been the case, where tens of millions of dollars are put into a new treatment plant, and because of a lack of ability to maintain the system, we're back in the community, 5-10 years later. And I think that for us, I think what we continue to see is, because that's such a fundamental issue, the lack of a ratepayer base, that to one of the tools that we really feel can help get to affordability is consolidation, is regionalization, so that you really start to get the systems that can be of scale to make the investments to be there, in the long term. But I think, as Zoe had pointed out, that it really is important that be community led. That the communities themselves really see that. The state of California actually has, we have at the State Water Board mandatory consolidation authority. I think we're the only state that has those. We've used it lightly. It comes with a lot of process, but it also comes with the state coming in, and the viability of the solutions and long term can be a little suspect, or not have the local buy-in that ensures that things are good for the long term. So it's, I think, a balance for us, because it's obvious that there's places where we need to force it, because it's not going to happen otherwise, because of deep-seated, sometimes candidly, racial tensions and inequities. So
I'd like to move us to solutions. I feel like we're starting to put our toe in the water with that anyway. Let's think about pathways forward. You've all kind of highlighted a few, but let's move into this space to have a little bit more of a positive tenor here. What actions do you think can and should be taken to really address equity concerns around water in the US? I'd love to go around and hear from each of you.
I can start the conversation for Indigenous communities, and I want to just remind the audience out there that there are 574 federally recognized tribes in the United States, and many, many more that are state recognized, and many more that are not federally recognized. And so I am sharing an experience of a project from one tribe. So one tribe, if you know one tribe, you know one tribe, and there's no generalizations that can go across the board for tribal communities across the United States. But what I can say is that for many Indigenous peoples, they have cultures and languages and beliefs that are really connected to the environment, to the place where they come from. And that really dictates how they use the water, how they revere the water, how their identity is placed in the water. I shared with the audience out there that I am bitter water, so I am water. And so for many people like that, water is very sacred. And so that means that there is often more conservation when it comes to water. So water use is much less than the average per capita in the United States. And then the livelihoods are placed, their livelihoods are based on the environment. So many, engage in subsistence practices like farming, ranching, fishing. And so water goes beyond just drinking water. And I once heard the Navajo Nation president talk about this, and he said that hygiene is the last priority when it comes to water. So, there'll be water for their plants, water for their livestock, and then water for household, water for drinking, and then hygiene comes last. So when you're in a pandemic, hygiene, becomes elevated, but then that's not a priority. So, when we're building these water access points, it's primarily for drinking water, but people are also going there to get water for other purposes. And so I think the way that people use water has to be understood, especially Indigenous communities. And then when you bring in technologies, a lot of times it's through type of helicopter research approach where things are dropped off. This is a great technology. Here it is, now use it, without even involving the community from the beginning, asking if they want this technology and training them for the sustainability in the long term. So I think there needs to be understanding of the water use, understanding of what the people's perceptions are, and involvement of the community in these new solutions that are proposed.
Thanks, Carletta.
I can go. Something that makes me feel really optimistic about the water equity situation is seeing the kind of community-led decentralized projects like Carletta talked about, because something that I didn't touch as much on in my talk, but that I think is important, is that we basically have two approaches to water services in this country. Either you're in a place that's served by a centralized municipal system and you're paying a bill that supports the cost of the system, or you have household level infrastructure, so a septic system or a private well. And there are serious affordability issues with those household level systems because the individual is often solely financially responsible for installing their septic system, maintaining it, installing their well, testing the water. And these are, again, often in low-income rural places where people really don't have the funds or the capacity to keep those systems working well. So I think that there's a need for thinking more creatively about middle ground solutions that are somewhere between a big centralized urban utility and a household system. So things like decentralized wastewater systems that serve a cluster of homes and are managed by a local entity, water kiosks, community scale water delivery, like the project Carletta described. And there are a lot of examples of communities developing these kinds of solutions already. There's also the Navajo Water Project, which is doing similar work, installing cisterns and bringing in clean water. And then there are some solutions that are meeting immediate needs, but that have the potential to become something more long-term. I showed a photo in one of my slides of a food bank in West Virginia that delivers bottled water to people where their private wells are too contaminated to use. And they're moving towards using atmospheric water generation for the water that they deliver. But I think those are great models because they're set up in conversation with the community and recognizing all of the local context and ensuring that what they're doing actually works for people. So that's one thing. And then something else that I think is really crucial is the fact that we don't really have a water or wash sector in the US like some other countries do, because of that idea that Everyone has water access here and our infrastructure is all sorted out. So I think that it would be really beneficial to build more of a community of practice and conversation between US water practitioners and people working in other parts of the world, like this conversation, because there's so much that we can learn from what's being done in other countries around decentralized systems, water access strategies, and just utility funding and financing, because there are a lot of other models than the more the US model, which treats water more as a consumer good.
Great, thanks so much, Zoe. Well, this panel is definitely challenging the myth that there are no issues around water access and affordability in the US. So for sure, thanks so much. Joaquin, Glenn?
Yeah, I may just plus up some of Zoe's comments there. Point of use technologies as well have been something that we've been looking at to better support here in the state and to better develop a sector around. You look at a lot of the products that are made for filtration or for addressing of various contaminants, and they have maybe at best a pressure sensor on that lets you know if the flow has been restricted, but no real way of knowing if the point of use device is still working or if there's issue with it. So I think that, and you look at most of the consumer sector, and it's not geared toward the sorts of solutions and communities that we're really working for, and it's more for affluent households that want the extra protection of a whole house water filter when they very well may not need it, given the high standards we have for municipal drinking water in the state to begin with. But really, again, the sector here and communities we're talking about often get missed, I think, in some of the development of those sorts of products. And I think it's continuing to engage and figure out how we have decentralized solutions that we know regionalization or consolidation isn't a solution for many systems because of their distance from a larger system to consolidate with. And so would also say that for us, we've worked extensively with self-help enterprises and organization based in the Central Valley and in California, and also our CAC and others to be the technical assistance providers for us. It's not our staff that are doing the work. We contract with then those local service providers that have the relationships, importantly, with the communities and with the local staff and ultimately workforce. That is really important to keep in mind as well of further developing and as part of a solution for many of our communities.
Of course, being from a large city and a major metropolitan area, it's really fascinating to hear this, and I appreciate it about the conversations around decentralized systems. It's just not kind of what I'm familiar with, but learning a lot today, which is great. I was going to reflect a little bit on really in terms of opportunities in water infrastructure investment as a pathway to jobs, and how we decide what to build and how to build it actually has a big impact on who can do that work, or perhaps taking the need to take a look at preparing a workforce to do that kind of work. But it's just very, very important to make that connection. And so to your point earlier, Joaquin, when you were talking about the priority to shovel-ready projects, just to get money out and flowing and kind of really kind of charging the economy, I think also I'm afraid that we may, in this kind of short time frame, lose out on thinking how this money could really benefit not just infrastructure investment, but really investing in people, developing a whole workforce. And one of the things that we found here in Philadelphia with our green infrastructure program, because the scale at which we've built it or continuing to build it, and then the need for maintenance of green stormwater practices, rain gardens, and things like that, is that we've really generated a local workforce. And those are real jobs. Some of them are contracted, some of them are city employees. These are real jobs that have been that have resulted from infrastructure investments that we've made. So I just kind of struck me, that was one of the things when you were talking about how kind of priority to shovel ready. I think that we're probably quite prepared as a large utility. We've got a lot, on the drawing board, but just making that connection to jobs and kind of from that equity perspective.
Yeah, you look at the challenges in the water sector, and we need more individuals. We need more folks that are coming to the sector, the best and brightest minds, because there's no shortage of work to be done, and a mind toward developing really the economies and really kind of looking at it as a systems approach to the challenges here. I think is really important, and people have to be first there. So I appreciate that.
Thanks. That's a great way for us to kind of end our conversation here about people first, a systems approach. It's wonderful, and thinking about new leaders and how we really nurture leadership in the water sector. Thanks. Thank you to all the panelists for your presentations and for engaging in this discussion. We really want to open it up to the audience now for some Q&A, and I want to turn it over to my colleague, Doug.
Hi, Andrea. Thanks. This has been a really good panel so far. We've learned a lot and really appreciated the diversity of perspectives we have here. Helen, we're also willing to open it up and let people ask their own questions if they want to raise their hands. So I was going to ask Helen if she's got 3 or 4 good questions on here, and I don't know how to prioritize that. So Helen, if you want to pick one of those and ask it, that would be great.
Yeah, of course. It seems to me that in this last discussion, the contradiction or potential contradiction between size, local control, local participation, and the need for resources, particularly at the federal level, often that includes a lot more bureaucracy. And we just haven't developed a kind of large scale concern. We're having enough trouble with just quality questions and supply questions. These additional equity questions are really tough ones. So I'd like to have a more general discussion about the importance of local control, local participation, and the need to scale up in order to get resources.
I'll take a first crack. What I often reflect on is that, really what we are kind of all collectively talking about is good decision making. And it's a continuum of that good decision making, to your point, at that local level, but to the state and federal level as well. And I think that it is really important to have at the base local leadership and local ownership of really complicated challenges that I can't replicate, at the state level, the sort of decision making to replace that throughout our communities. And I think, what we find though is that there's sometimes there's a lack of capacity for the good decision making, but importantly the resources, the lawyers, the consultants, engineers, the folks that can do the environmental work to get a project through. To really do that. And so what we're finding is that the state has to provide that more, that support for that good local decision making in a way that hopefully doesn't do what it can, which is make it feel as if the state's coming in to run things for that community. I think you see that in the Sustainable Groundwater Management Act in the state of California, the way it was passed, the way it has great deference to that local control, but ultimately has backstops that the state is there to try to help fill. So for me, it's making sure that we have those technical assistance dollars, we have the community partners, we're funding them, that local capacity to then have that better decision making and have hopefully solutions that are more long term, because we're being more mindful of that. As I said, our 400 largest agencies serve 95% of the population, and the level of service for the state revolving fund, for our state programs that requires from us to engage those systems, and then those systems that are 500 connections are smaller systems, they're completely two different really levels of service. And it's the way I've begun to really view it, is that we can't expect that same capacity from the smaller systems, and instead the state has to fund it. The state has to be there to help build it. Otherwise, it then just falls onto the state. Otherwise, if we don't build it locally.
Then can I follow up with Zoe and Carletta and ask them from the bottom up, does it feel like local people are able to access expertise and structures at the state level in an effective way?
I'm thinking about my response. I think,
no, go on, Zoe.
I'll just say in what I saw in conducting the water access research, that was often not the case. There wasn't much of a relationship or communication between state level offices and funding bodies and local communities. And I think it's partly due to a lack of trust, which makes a lot of sense given the kind of historical injustices that I talked about. So I do think there needs to be a lot more focus on building those relationships in a way that actually generates trust and that recognizes the expertise of the communities themselves.
I can chime in on that as well. The answer is no. They do not have direct access to state. A lot of the local communities we found are key to water access and even water use during this past pandemic. However, the local chapter governments are not funded adequately or fully to have the full capacity to manage local water resources. A lot of it is managed at the regional level, which makes the regional water managers their overcapacity and dealing with the pandemic and even their own impacts from their own offices make it even more and more challenging. Training is critical, and that's one of the things we've been trying to figure out in our work, is working with the local chapter, finding ways to train the local chapter on water maintenance so that they can increase their capacity. While at the same time, many of these individuals are volunteers, and they may already have another full-time job that they're doing in addition to, their local volunteer work. So there's just not enough funding at the local level to even manage their waters adequately at the local level. So that's just a huge challenge. And a lot of the state access connection happens either at the central Navajo government level or at the regional level, not at the local chapter community level.
I would also add, just quickly in response to the overarching question, I do think there's a contradiction between the need to do very slow trust building work at the local level and the scale of the problem and the need to scale up. But I think that can be partially resolved by distinguishing really clearly between emergency response and long-term solutions, because there are approaches like delivering bottled water or the shut-off moratoriums that were put in place last year that meet people's immediate needs and recognize that they can't wait another day for water, but also keeping in mind that those shouldn't be the permanent solutions, that bottled water deliveries are not environmentally ideal and they're not what communities want. But people need they need their needs met while the longer term solutions are developed, and that can hold people over while the long-term work is done in a more, I think, a more responsible way and in a way that involves more community members. And I'll just say, I always think hiring people who are from the communities and have experienced the water impacts that you're working on will really strengthen the sensitivity to context.
Thank you. We have a question from David Puente. David, I don't know if you want to ask it. I'll give you a second if you do. Otherwise, I'll just do it for you. David asked about customers and renters, and this may fall more towards Glenn, but others of you, I'm sure, are working with that as well. We often think of homeowners as customers or as who we're targeting this, but there's also a lot of people who are renting or otherwise occupying space in their communities. And how do you think those issues come to play? Especially, sometimes the renters are paying they're not paying a water bill, it's just through the rent that they pay to their landlords. So any comments on that?
Yeah, it's a challenge, and it's something that we've talked about. So that in order to qualify for the assistance program that I talked about, you need to be a customer. So you need to have a water account and a meter that's in your name. So we do have a process for people to become tenant customers, but ultimately the landlord needs to approve that and approve having a separate meter installed. So it is a concern and something we talked with some of our elected officials about, of how can we better offer assistance to people that are renters. We have a fairly high homeownership rate in Philadelphia, but still, I think it's about 47% of the population are renters. So it is a gap.
Can add, I've also been working for the past year on affordability in a number of cities, and I think it's definitely an issue. There's also the issue of power dynamics between landlords and tenants, especially if people are in like a housing unstable situation or on the verge of eviction. So it's another thing that can make it really hard for tenants to access any resources that might be available to them. But one thing I've heard about that I think is promising is looking for other ways to credit renters for the discount that they might be eligible for on their water bill, even if they don't have an account directly. So it's easier with utilities that do both water and power because they can be credited through the power bill. But there may be other opportunities for that, looking at like other kinds of discounts or social services that people are enrolled in.
Thank you. Sharush, I see you have your hand up. Do you want to ask a question?
Yeah, thank you very much, Doug, and thank you all the speakers and panelists. Wonderful conversation. I actually have maybe a multiple number of questions, and but I'll start first with Zoe. Zoe, you gave a couple of interesting examples from individuals. Particularly, there was a household where you said the family felt that the quality of water was such that even when they washed their face, their eyes burned. Out of curiosity, is this part of the water distribution system that also serves the neighbors as well? Or was it just, you see, because the question is it just an isolated case or is it much broader? Because sometimes these examples, of course, highlight certain problems, but the fairness to at least communities that serve the water, is it only specific to that house or much larger scale?
Yeah, there's a lot of cases of both. There are a lot of situations where something in the household is going wrong, like the pipes in the plumbing within the house are contaminating the water in some way. In this case, that was a family that used a private well in California. So the groundwater there was contaminated by agricultural runoff. So it was affecting, like, everyone in their neighborhood also had a private well and their wells had the same issue. And part of that town, I believe, was served by a centralized water system, but it was also using a well drawing on the same groundwater. So when the source of the contamination is the water source itself, it does affect the whole community, whether they're on household level infrastructure or a central system. But yes, there are also cases where it's something related to the household, but those tend to be, they're still not isolated incidents because often the housing in the area is all similar and has the same issue. So like in more urban places, older housing stock can have lead in the fixtures within the home, but not in the water system itself. So it's still affecting people's drinking water. And that tends to be like a whole neighborhood that all has that issue.
Thank you. And my next question, probably both Joaquin and Carlelia, we were talking about centralized versus distributed. Okay, I can appreciate with respect to the distributed system. I come from Iran, and in the Middle East, I guess septic wells, etc., were just as still as common as it is, and it's not as regulated as it is in the U.S. At least there are some standards that have to be followed in order to place those underground, and so that one we can leave alone. But when it comes to the water supply and drinking, which is really more critical, decentralized systems really require technological advances that are enabling that you can actually go on to Home Depot, etc., or whatever, and purchase a unit and just come and put it there. And Joaquin, I think you mentioned that in some cases, the only thing that they may have available is just a pressure gauge to decide whether the pressure has dropped or not, or whether the filter is working. But there are so many other constituents that a centralized system monitors. And when it comes to decentralized system, you're left pretty much alone unless you really care about your health, whether there are different chemicals. Where do you think our technological advances, are going to play a key role? I can use the analogy with power. Now every roof you see has solar panels, and they've become a little bit decentralized, but that's driven more by costs. So, any comment on this? I really appreciate it.
I appreciate the question. We have examples, say in the Eastern Coachella Valley, where we have point of use systems that have been distributed in a mobile home park that has arsenic contamination. There's technicians that come in on the regular and change the filters, and there's operation maintenance that's kind of tied to it that I think is important for any success. But we don't have a lot of projects like that are really using either a point of use device or lending it. And I think what the solution is really further development of the market for those sorts of products, really regulatory grade, if you will, sorts of products that aren't just on sold at Home Depot or on the consumer side, but really are being manufactured and specifically developed for communities. Knowing that, the problem is that it really is dependent on the analytes and the contamination that you're needing to treat for, whether or not you can really reliably use something that's existing out there, filter wise or otherwise. But I think that it really is needing to be developed as a market, and I think it can be if the state continues to see it as a solution, and that we're pouring dollars and funding toward it. We can hope that the additional sorts of systems are on the horizon. I'll note that we have used some of our dollars for a remote system. UCLA and ourselves, I think we're partnered in seeing if, and I believe it was in the Salinas Valley, if a system can be developed that is remotely managed, so as to be able to kind of scale out what could be smaller distributed systems addressing communities, but come with again a remote ability to remotely administer them, understand what's happening, and cut down theoretically there on the costs of having to run those systems. I think there's again innovations like that could really come to bear, and I think it's exciting because I think there's a lot more dollars certainly flowing to those solutions, and then the potential to really be further developing a market really, and engaging in a discussion of what are the community needs and where is the technology headed, what are the opportunities to help bridge the innovation that I think we really need to see.
Thank you. Carleta, you want to comment on this from your perspective?
Yes, Suresh, what you asked is a very challenging question, and my project is research and development, and so we are trying to address that question with similar to what Joaquin said about piloting in specific communities, knowing their water quality, working with technicians who are from the community to design specific systems based on the water quality of that area. And then our goal is that this would be something that would be developed and produced by a local Navajo entity to make it easily accessible and affordable to Navajo users using easily accessible parts, like say from Home Depot. Otherwise, the people are continuing to not use anything and not have any treatment to their water that have elevated levels of arsenic or uranium. So we're working on that. I don't have a good answer for you. Maybe in the several years we'll reach something, but we have been working with Big Deep, Six World Solutions, who are working in the community, who have trained and pay full-time technicians to install water cisterns, rainwater harvesting system, et cetera. So that's one stepping stone towards having that local monitoring of water quality for drinking, to meet drinking water standards.
Thank you so much. And if Doug allows me, I have one just comment on this and a follow-up for Glenn on a different point. To be honest with you, I think the technological advances happen at the university laboratories and centers. I give you a case in point, Michael Hoffman at Caltech and my colleague Sunny Jiang here. They've had a project with support from Bill Gates and Melinda Gates Foundation for a number of years to really go from toilet to tap, if you wish, self-contained unit. And of course, their focus is more international. We go to India and other places. So it's interesting to look at some of the advances that have been made. But of course, these are high maintenance systems. The challenge is, how do you create incentives for industry to go and mass produce and distribute it? And this is where it comes to the financing and whose responsibility it is. I'm not really into that. I'm an engineer by background, but I always go travel and I see situations, say, my God, we know that the science is able there to help, but maybe they don't make money enough to really implement these at a large scale. But Glenn, coming to a larger city like the one you deal with, I wonder to what extent your discussions or decisions, etc., are affected by the academic community. Do you have advisory panels? I again speak of my bias since I'm an academic type. And you have great universities there, a lot of experts in various aspects of the topic.
We do, and so we do have partnerships with our universities. A lot of the focus has been really on our green stormwater infrastructure program. And so working with Villanova University and Dr. Traver there, Drexel University, Dr. Montalto is a partner. So we certainly do. It's not something that I work directly with, but in our planning and environmental services division has very close collaborations with our university partners.
Well, thank you very much. Before Doug sends me a nasty note.
Thank you. Yuri, I see that you have your hand up. I want to give you a chance to ask a question.
Thank you very much. And real thanks to all the panel members for bringing out their perspectives. A few questions. One, we convened under the title of COVID. What is the impact of COVID on what we do? Some of us around the table have spent the last 50 or more years in the water sectors of the United States and of the world. My neighbors in the Middle East, the Palestinians, the Syrians, the Egyptians, and the Iranians that Soroush was talking about, as well as the water industry in the United States, would I see any different panel speaking 30 years ago? Or would the problems be essentially the same and it's just a repeat? What is the driving force that COVID has had, if any? First of all, on the industry itself. But the second one is, society does not spend enough on water in general and on the water infrastructure. I worked in Philadelphia. That was about 700 years ago. And I don't know whether there is a difference between the water system in Philadelphia, as I knew it at the time, and what is there today. So going back and trying to hang myself onto the topic of COVID, is there an impact of a pandemic, a different emergency? Would there be the same effect for fires in California, for example, or for other issues? COVID is a worldwide pandemic, and it does not know any borders. Is there an effect on what we do in the water industry in the United States and in other parts of the world that have capacities that may be the same as the Navajos have in the reserves in the United States? Is there an impact in the political arena of the United States and of other places because of the pandemic to invest more or to do things differently or to organize the water systems, whether it's distributed or central, or what is the mutuality between different and adjacent systems that is caused by this? What do we use in the water industry to create enough impact on society and the politicians and the financial world and so on? We do this when there is a crisis all the time in everything, not only in water. It's the same in transportation, it's the same in other things. So I get back to the question. Has there been an impact of Corona per se? Or is it just another blip on the political, social thing that we're using essentially, or we should be using, or we can be using in order to cause changes in the way things are done? And if so, what and how? Thank you.
Thank you, Jerry. I think that's an excellent question to close on. It's sort of what is the uniqueness here with COVID? Both challenges and hopefully some positive opportunities.
And I didn't say the word uniqueness because we do use continuously these events, these crises, as a leverage on ourselves, on society, on the political arena. If there is a real crisis, all of a sudden the politicians jump up and it becomes very attractive for them to address themselves to this and so on and so forth. Is there anything unique about COVID? Well, there is one property, and that's the universality of the pandemic. It doesn't know any borders. If you're sick in Iran, you become sick in California. And if you're in California, then in Vancouver, they have to close themselves down or whatever it is. Is there a specific property of a pandemic like the corona or other events that guides essentially the way in which the water sector manages itself over decades? And I'm old enough to tell you what it was in the 50s and the 60s and the 70s and so on. And I wonder whether it's just another déjà vu. Is it the same? Is it different?
Joaquin.
I think
I'll go ahead and let Zoe or others start.
I think for Indigenous communities, it has made a difference in that the water insecurities have been voiced and shown nationally, and funding has been dedicated to that, where prior to that, it was very difficult. You know, the water rights had to be adjudicated or settled before water infrastructure was funded. And that can take decades and congressional acts and, you know, negotiations in the state to do so. So I think hopefully it's going to make more than a blip in terms of water access in on the Navajo Nation, because there were several shovel-ready water pipelines that were in the works that are now being funded. In terms of decentralized types of units, I think that still has a long way to go. Most of the attention is on these more centralized water pipelines or in Navajo communities. So I would say yes, but with a reservation on that in terms of the changes for decentralized systems.
Interjection, more or less than lead in the water in a certain city?
I would say more, definitely more.
Sorry?
More.
COVID has more effect?
Yeah, I can't speak to effect on people's health, but I would imagine it's frustrating for communities that have been talking for years or decades about how the water access and affordability and quality issues are public health crises, and there hasn't been as strong of an official response. But I think there is definitely more of a response to COVID as a water issue. And I talked about the decline in federal funding. The potential federal funding that's coming through the infrastructure bills is a really historic change and possibly a shift back to that paradigm of having more of a role for the federal government in water investment. So I think it's a very significant and unique change with COVID, and I hope that water equity and access continue to be seen as a priority as the pandemic changes or recedes, and that funding is long-term and not just one injection of resources in response to a one-time emergency.
And I'll add, it is a bit deja vu. It's not lost on me that you look 50 years ago during the passage of the Clean Water Act, the passage of the Clean Air Act, passage of the Safe Drinking Water Act, and importantly, passage of the Civil Rights Act, passage of the Voting Rights Act. These issues of inequity, racial inequity,
and the Endangered Species Act.
Exactly. I mean, it was a pretty critical moment where we were all looking around. There was rivers on fire, which a similar, kind of crisis moment that really, solidified a common vision, if you will, at least at the federal level, of a desire for clean air and clean water. And here in California too, at that same moment, those same realizations and discussions around, well, how do we make clean water and clean air the basis of our economies, but importantly as well, racial inequities be resolved. And they weren't. And we are kind of in a deja vu moment because we do now see this federal investment coming back down, because you look at transportation, you look at the subsidies that go to all of our major sectors from the federal government, and they're there because they're the basis of our economies, right? Because they're so fundamental to our workings. And yet water and sanitation were really eroded, especially in the 80s. And so we are kind of building back, and it is a bit of a deja vu moment, but it is a catalyst. COVID has been, with the moratoriums that were put in place among a number of states, really connecting directly access and sanitation and health, and how critical it is to communities that be preserved. You also saw studies that were conducted that act of putting in those moratoriums saved lives, measurably saved lives. The states that enacted them had better health outcomes that could be associated with it. So I think that the COVID, and then here, as Zoe said, now with the federal infrastructure dollars, but even in the state of California, because of this focus, I talked about that safe and affordable fund, $1 billion over 10 years. The State Water Board received $1.3 billion in one chunk just this summer from the state legislature for drinking water and wastewater systems. So that and it was a direct response to, I think, what has been, as again Zoe said, and Carletta and others, that generations of decades here of struggle for many communities to be seen and to have their challenges taken head on. And I think that we see incredible momentum for it. And I think COVID had a lot to do with, again, really highlighting that nexus and importantly, showing the racial inequities from COVID deaths generally. You look at the communities that were most impacted by COVID, you look at and it very well matches the communities that don't have access to water, have continued to have challenges achieving the same equity and clean air and clean water that I think, again, all of us have kind of taken for granted now 50 years after passage of those laws. And time for us to re-envision and remember that we do have to recommit to ourselves to these issues. They're not here obviously so easily addressed in 50 years.
I'm not a US citizen, But I look at the government change in the United States and I assign to the change, a shift in priorities with respect to infrastructure.
Glenn, did you have any comments on that question?
I don't really, yeah. I mean, I agree with everything that's been said, and I think it really shone a light on existing issues. But finally, there has been attention on the issue of access and affordability. So I'm hopeful that that will translate into policy. It's really tough to know what's going to happen at the federal level. We had, obviously it's great to have the infrastructure bill, but things are close in Washington right now. So just sort of hold my breath and see where things go. But I agree. I think what COVID did was just really highlight issues that were there, but just brought them to the forefront in a way that could not be ignored.
Thank you. And I want to thank all of you for participating today. This has been a really lively and great discussion. We've gone over our time, and I thank you all for staying on for that. But it's been really great to have this discussion. I'm going to turn it back to Sharush for some closing comments.
Yeah, thank you so much, everyone, and wonderful talks and discussions. On behalf of the advisory board and the committee members, I thank you all for speakers, exciting discussions. At the end, my own 2 cents worth is, I think the talks were mostly maybe a little bit US centric, but I think in terms of the global implications, the resiliency of the system based on all the previous laws that were mentioned gave US an edge here. So therefore, you don't really see much impact on water treatment facilities, particularly at the beginning of the pandemic when everything else kind of stopped working. But in most other parts of the world, that's the question, to what extent that has been affected. But that's probably a subject of some future discussion. And again, I thank you, and I wish everyone a wonderful evening or rest of the day. And we see you for the next Rosenberg Forum that will be in February, Sherry. I think, yes, February 8th. And the topic is groundwater in mega cities, which is really of a profound problem at the global scale. With that, thank you so much and goodbye.
Okay, goodbye.
Bye, everyone. Bye.
Thank you.
Bye.
Thanks, everyone.
Thank you.
Thank you.